In this video, we're going to talk about a procedure that I think is going to be a game changer in the future. You may have heard me talk about rib remodeling, where typically we're going after the lower ribs to help change their shape and bring them in. But a part of rib remodeling that I haven't really talked to you guys about that we're now offering here in Miami is the front rib part. So some patients will notice that on the front of the chest, in women just underneath the breasts, in men just lower down at the top of the abdomen, they may have flare of the ribs down there. Sometimes you only see it on one side, and in those cases it can tend to be a bit more obvious, or it can be on both sides. And typically in patients we do this surgery on, a very common complaint is no matter what they do, diet, exercise, this rib flare, or the fact that the upper ribs stick out, they always look like the belly sticks out as well, and it's difficult for them to get a smaller waist regardless of what the gender is. And so the treatment for that, again, it was invented in Lima, Peru by Dr. Manzanera, is called the front rib technique. And it's really clever because it's minimally invasive. We do it through a little needle stick, and so there's no scar left behind. So what we do in this situation is we identify what is called the mother rib. So what is the troublemaker, which rib protrudes and sticks out the most. In general, it tends to be the 8th rib. We're going to look at the anatomy of that rib and see where it joins to the bone and where it joins to the sternum or the breastbone. And what we do is, using this little device here, the piezotome, which is a really clever device that allows us to do it through just the needle stick, we're going to take the rib off, we're going to disconnect it from the cartilage, making it stick out, and in this way we're going to make the whole area flexible so that we can put you in a corset and bring down that protuberance at the front of the chest, upper abdominal area. Typically, patients are going to go into the corset for at least 3 months after this surgery, but as you can see, the results can be an absolute game changer. So people are able to get smaller waists, or symmetry in the chest where there may not have been symmetry before. When we look at chest shapes and its relationship to the abdomen, both for men and women, this tends to give a more athletic physique. So in women, we can get that smaller waist, we can feminize that torso. But the same thing with the men, because we're going to want to get that V shape, bring the shape of the waist in, make the shoulders look more broader, and make it so you don't have that kind of pot belly appearance that the protuberant ribs can give. It's a really exciting time because in plastic surgery we used to modify the soft tissues only. That's the only thing we had available to us, the fat and the skin. But in more recent years, innovators like Dr. Manzanera have brought around safe techniques where we can actually modify the skeleton and get really groundbreaking results, like in this patient. My name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida. We are offering rib remodeling via the RibScar technique, which is that minimally invasive way where we just do the little needle stick, or front rib as well. In patients who are suitable candidates, we can offer that too. If you're interested, just reach out. I'll put my contact info in the comments below.